Good afternoon, everyone, and thank you all for joining us today. Seattle King County Update, a public health directive on face coverings. Today, we'll be hearing from four of our county leaders: Mayor Jenny Durkin, King County Executive Dow Constantine, Dr. Jeff Duchin, and Matias Valenzuela. As a reminder to everyone who's in the audience, we are having a moderated Q&A today, which will follow the press conference. If you are asking a question, please include your name and agency. We will not consider anonymous questions, and a moderator will read the questions following the program. With that, I will hand it right over to County Executive Dow Constantine.
Well, thank you, and good afternoon. I'm pleased to begin today by joining all of you in expressing our gratitude for the incredible work being done across King County by our essential workers and also those who have understood and embraced the public health challenges that are necessary to fight back against this disease. And I want to take a moment to express my deepest condolences to those, the friends, the families who've lost loved ones. For those who've lost people from their lives, I want you to know that the community stands by you in these difficult times. We received word that someone who was much cherished here among my peers, folks I grew up with in West Seattle, our old music teacher, Don Weaver, passed away yesterday after a battle with COVID-19. He's someone who taught us in elementary school and high school and led the community band for decades after that. And it is just one more tragic reminder that the work that we're doing here is the most serious possible, and that we have to all pitch in if we're to protect those who are the most vulnerable. I'm joined today by Mayor Durkin, as was mentioned, and by our Public Health Officer, Jeff Duchin, and also by the Equity Director for Public Health Seattle and King County, Matias Valenzuela. I am joining you today along with these other officials to urge the use of face coverings for all indoor and for public settings where social distancing is difficult. And by face coverings, we do not mean the N95 masks, the high-grade surgical masks, which continue to need to be reserved for our frontline healthcare professionals. We're talking about the fabric mask or the scarf, the bandana, or the disposable but non-medical mask that can cover your nose and mouth. There are, by the way, right ways and wrong ways to wear these masks and or these face coverings. And public health has a lot of helpful information on how to do it correctly. And that will be on their website, and we're going to be sharing that on social media platforms as well. We want residents to wear face masks in all indoor situations where they're likely to be in close contact with strangers. So what are we talking about? The grocery store, the pharmacy, the hardware store. Doing this is one more step we can take to help keep those essential workers at those businesses safe. The local health directive will state that people do not need to wear face coverings outside, but they should if it's in a confined area where they're unable to get appropriate distance from others. So if you're visiting the farmer's market, for example, or you're going to your restaurant's curbside pickup, then wear a mask. For Metro, King County will now require the use of cloth face coverings. Our operators will be playing reminders about this new requirement over the vehicle's public address system. The most obvious question I expect people to ask is, why now? Well, the answer is this: we are at a precarious moment in our battle against this virus. As we've heard from Governor Inslee, the state has proposed to further loosen social distancing restrictions if the rate of infection continues to decline. To ensure we can continue along a path that leads to greater normalization, we must do everything possible to keep people safe and to avoid a bounce back in hospitalizations and death. It is critical that we continue to slow the rate of transmission, even as we increase economic activity, so that our recovery can be a one-way trip and we don't end up back in a full stay-at-home order and another shutdown of our economy. We must take this extra step, informed by public health, to once again change people's everyday lives in the service of the broader good of the community. Now, by doing this one simple thing, wearing a face covering when you're in a public setting, we can protect essential workers and the most vulnerable and increase the odds that the reopening of our community will be successful. I want to talk about the fear experienced by those who say wearing a mask makes them feel vulnerable to bias and ill treatment. This is a real thing. Discrimination and hatred must be called out in all situations at all times. But right now, it is particularly serious that people could be made to feel vulnerable to racial profiling because they follow public health requirements. This directive is not a new license to harass anyone or intimidate our neighbors who aren't wearing a cloth face covering. We are not going to stand for that. We must work together. We have to work together to educate and inform all the residents of the county about the need to support each other as we take the actions necessary to combat this virus. Wearing a mask may be an inconvenience. It may feel awkward. It may look a little silly. But know this, it is a sign of our mutual concern for each other. It is a visible commitment that we are doing all we can to keep our community safe, to keep our neighbors safe, to keep ourselves and our economy on a path to a healthier future. It is my pleasure to introduce to you the mayor of the city of Seattle, Jenny Durkin.
Thank you, Dow, for that. And I want to thank Executive Constantine for his work over the last 2 months. I could not have asked for a better partner for the city of Seattle than King County. We've been working on every front together, whether it is helping to shelter and provide quarantine and isolation for people experiencing homelessness, to how to address a whole myriad of issues. I think together with the governor and the other mayors and county executives, our region has been very fortunate to have a unity of government. It doesn't mean that there aren't differences in different parts of the state or even the county, but it means that we need to proceed based on what public health and the science tell us, and that we also give the public information about what they need to do to overcome this virus. I will tell you, I am so proud of the people of Seattle and the people of King County who have done what we've asked them to do, who have given up so much to get to where we've gotten. So many small businesses have closed. So many people have lost their jobs. People are staying at home and doing what we've asked them to do. And as a result, we did save our healthcare system from getting overrun, and we were able to flatten the curve. But as Dr. Duchin, I'm sure, will tell you again, in which Dow Constantine and I agree, we are far from out of the woods. Still, far too many people are getting the virus, and people are continuing to die. And this is when we are in the most restricted situation we have. As we begin to reopen our society and our economy, we know that people coming back together will also provide an opportunity for the virus to spread. So we want to make sure that we're taking every step we can to reduce the transmission of the virus. And today's directive from Public Health is fully supported by me and people of the city of Seattle. We want to make sure that people in every public place are doing what they can to slow the transmission of this virus. And that's why this directive today is requiring people, when they're in public places where they cannot social distance, that they do wear a face covering. Again, as the executive said, we do not want you to go out and buy N95 masks or surgical masks. We still need those for our healthcare providers. We also don't want the mask to give you a sense of self-confidence or false confidence. You still need to socially distance. You still need to minimize the amount of time you're spending outside around people. Right now, the order is still stay home. But we do know that the mask can provide some protection to both the people that don't yet have the virus and provide some protection against transmission by people who do. We didn't know at the beginning of this outbreak, for example, the degree to which people who did not yet have any symptoms might be contagious. It's pretty clear now that they can be, and so anything we can do to limit that transmission is going to help all of us. I also want to echo what the executive has said, is we in this region will stand up against any kind of discrimination, whether that was the stigmatization of the Asian community by many at the beginning of this and continues, or whether it would be profiling against anyone because of their mask or because of our already having discrimination and profiling against communities of color. We won't stand for that. But what we will do is come together collectively and continue to show the kind of responsibility that we have shown as a region over a long period of time to say that we know that we can join in this fight against the virus. And this is yet another way we can do that. I want to thank Jeff Duchin and Patty Hayes for their tireless work. I think I know for a fact that they probably have not slept in over 2 months since it became clear that this virus had spread in our community. And I want all of the public to also realize one reason you hear so many different things on an ongoing basis almost every day is there is no playbook that was pre-written for this virus. So that's why we have to rely on the science experts, the epidemiologists, our public health experts to tell us what they know about this disease and other diseases and how we can protect ourselves against the spread of it. As we start to come out again, as our economy starts to reopen, but more importantly, our society starts to come together, we know again that that will leave us more vulnerable because probably 95% of the people in Seattle and King County have not yet been exposed to the virus. That means we're susceptible and vulnerable. Today, we take one more step to stand as a community together to make sure that we will take every precaution we can against this virus. And with that, I'd like to introduce you to Jeff Duchin, who many of you have known has been on the front lines of guiding the county and our public health response here in our region and is nationally recognized for his work. Dr. Duchin, off to you.
Thank you, Mayor. Thank you, Executive Constantine, and thank you everyone for joining us today. As many of you know, we've made real progress in decreasing the intensity and trajectory of our initial COVID-19 outbreak. But as you've heard, we continue to experience significant transmission with too many cases occurring, not only among our most vulnerable residents, but also in our families, workplaces, and neighborhoods. So our struggle with COVID-19 will go well beyond decreasing this initial peak and will likely last for months, requiring us to reconfigure many aspects of our daily lives and our physical environment. At this time, with more of us beginning to get back to work, there's a real threat that the outbreak will flare up, and we need to work together to do everything possible to decrease the risk for a surge in illnesses, hospitalizations, and deaths. Last month, we advised the public of CDC's recommendation to wear masks to prevent the spread of COVID-19. Today, I am re-emphasizing that advice by announcing a health officer directive for all people to wear face masks or coverings in indoor and outdoor public spaces where they cannot maintain distancing of approximately 6 feet. I'm also directing all commercial establishments in King County to post signage advising individuals to wear face coverings on the premises. The directive includes indoor and outdoor public settings and is especially important for indoor spaces, including groceries, pharmacies, other retail locations, and transit. This directive should be used to educate, encourage, and persuade individuals to wear face coverings and does not create grounds for residents or law enforcement to stop, detain, issue a citation, arrest, intimidate, harass any individual who does not comply with it. Why are we doing this? Masks and face coverings block the spread of virus-containing droplets created when someone coughs, sneezes, and speaks. And that protects others from infection. COVID-19 is highly contagious, more contagious than influenza, and an infected person can spread it to others even when they don't show symptoms, and this is critical. This infection spreads from people before they know they're ill. Because COVID-19 can spread from people who don't show symptoms, we can't rely on avoiding contact with ill people to protect ourselves. And for this reason, our community interventions like physical distancing and mask use are critical to slow transmission. The key point to understand is that by wearing a mask, we're protecting others from COVID-19. Your mask protects me, my mask protects you. Wearing a face covering also provides a clear signal that we care about each other and can serve as a reminder for distancing. It's important to remember that a cloth face mask can reduce but does not eliminate risk. Minimizing non-essential activities, physical distancing, and frequent hand washing are most important. Cloth face masks must also be worn properly to avoid contaminating the hands or face of the user. Before putting on a mask and after removing a mask, an individual should clean their hands with alcohol-based hand rub or soap and water, and change masks when they're moist and wash them with household laundry after use. And when in use, avoid touching the mask. For everyone's sake, stay in your place, maintain space, and cover your face. And with that, I'm going to turn over to my colleague, Matias Valenzuela.
Thank you, County Executive. Thank you, Mayor. Thank you, Jeff Duchin, our Health Officer. So in recent weeks, as we've looked at where transmission is happening in the community, we have seen how communities of color are disproportionately impacted by COVID-19. For example, we know that in the Latinx community, the Hispanic community, the Pacific Islander community, the Native Hawaiian community, we have transmissions that are 4 times higher than whites. For Blacks, African Americans, it's twice as high. We have a disproportionate number of people of color who are essential workers, who have a greater potential for exposure to COVID-19 than those who stay at home or telecommute during these difficult times. Unfortunately, many of these same workers are lower income and living in multi-generational households, often where there are many others in the household with underlying health conditions that make them more vulnerable to complications from COVID-19. By all of us wearing non-medical face covering in indoor public settings and in outdoor public spaces where it is difficult to maintain physical distancing, we are protecting those who are essential workers and many others who may be vulnerable. In creating this directive, the Office of the Executive on Public Health, South King County, we have engaged with a broad set of partners, especially those who are disproportionately impacted by COVID-19. Thank you to our Pandemic Community Advisory Group in particular for helping us shape and inform how we implement this directive. Those in essential businesses and frontline employees must be protected. At the same time, we know of the history of racism and discriminatory policies that affect Black, Native, people of color, plus those who are immigrants and refugees, those living with disabilities, and our LGBTQ community. So we want to make sure everybody feels safe while wearing a face covering. Importantly, there's no penalty for not wearing a face covering. Law enforcement will not be involved in the enforcement of this directive. Plus, we must understand that there are some people, such as those with disabilities, who will not be able to wear face covering. And there are people who may have their own conditions and circumstances that would make wearing covering difficult or even dangerous. Lastly, we know that not all communities have ready access to face covering, and we are working to increase access for our communities and those organizations, such as those serving older populations, those living homeless, food banks, and many others. Thank you for helping us protect our community. I will turn it back to our County Executive, Val Constantine.
County Executive, you're currently on mute.
I believe that you have the ability to take some questions now for any of the 4 of us.
That is correct. We have lots of questions and not a lot of time, so I will go through these as quickly as possible. But we will not get to everyone, so we will have to answer some of these after the conference. Starting with the question for you, Executive. The question is, this past weekend, I'm Carolyn Bick, South Seattle Emerald. This past weekend, I saw more people without face coverings than with face coverings, and saw them clustering together in parks and private businesses. Spoke with a couple of people and they don't believe wearing a mask will make a difference. If we are not going to actively enforce this, why even urge people to do it?
Well, thank you for the question. As has been the case with our other measures, when we have asked people to take an action and explain why, as Dr. Duchin already did and will again in response to this question, people have largely complied. We cannot succeed if we turn these social distancing and other protective measures into some sort of cat and mouse game. It needs to be a voluntary, broad voluntary compliance within the community because everyone is pitching in to help the community succeed. King County has had remarkable success from the very outset with this. Primarily through the early and entirely voluntary measures that were taken here. We put out the call for people to work from home if possible to protect seniors and those with underlying health conditions. Hundreds of thousands of cars were gone from the roads within a week. That is the same kind of help we need now with this. The standard is to wear a mask when you're in a public setting. And we are encouraging everyone to comply. Dr. Duchin, again, could you make comment on the issue that was raised there of people believing that masks wouldn't do any good?
Yes, thank you, Executive. It's true that the data on cloth mask use in the public is inconclusive. However, there are studies that show that cloth mask use can decrease those droplets that are spread from someone's mouth or nose when they cough, speak, or sneeze. And we are facing an unprecedented situation that is very grave. And we've seen that despite our best efforts to social distance, we're still experiencing a large number of cases. And we're very precarious in our position in that we can see an increase that will double every couple of days if we're not careful. So at this point, even though we're typically used to making recommendations that are based on a large body of evidence, we think that it's very important to move forward based on the available information and recommend this measure to decrease the risk of transmission of COVID-19 from people who are asymptomatic and do not yet appear to be ill or know they have the infection. This is an incredibly important thing, given the fact that we have really maxed out our stay at home. We don't want to have to go back to locking down communities. I'd much rather see people lock down their mouths and noses than lock down their neighborhoods. So we're really trying to layer on another potentially beneficial strategy in addition to what we will need to continue to do. All of us will continue to do as we reconfigure our lives in response to this epidemic. We are all going to need to exercise some degree of social distancing. We're going to need to try and maintain space of 6 feet from one another as we move forward. We're going to need to avoid ill people. We're going to need to have meticulous hand hygiene and make sure our workspaces are designed safely. That's another critical piece as we go forward. But wearing fabric face masks is also an important strategy at this point, given the extreme gravity of this outbreak and the fact that it will be with us for many, many months.
Mayor Durkin, would you like to speak to the city's position on this?
Yeah, I just want to echo what Dr. Duchin and Executive Constantine has said, and also in response to that, one thing I did not mention in my initial response is we understand that some people may not have equal access to face masks or face coverings. And so the city of Seattle has 45,000 face coverings that we will be distributing to community-based organizations so that those communities who either don't have access or where there's some communication issues will be able to get those face masks. So we're doing everything we can to communicate this in multiple languages to get to community-based organizations and trust, and we will continue to do that.
And thank you for the reminder, Mayor Durkin. King County is joining the city of Seattle in this. We have 115,000 masks that will be distributed primarily with the assistance of community-based organizations, masks of various sorts that will help people who don't otherwise have access be able to fulfill the request of the public health officer under this directive.
Thank you. On that same vein, question from Gabe Gorente from Eater, Seattle. Will the city or the county help restaurants source masks for their staff, since this is something required for their business?
I can tell you, and thank you for the question, that we are in active conversations about whether businesses are going to be able to access the material they need to keep their employees as safe as possible as they cautiously restart operations. And that is a conversation that's happening not just between us at King County, the city of Seattle, and other cities in the state, but also with our partners in the private and philanthropic sector. We have been working through our emergency management function to acquire PPE, but we need to make sure that regardless of the user, whether it's a public employee or a business that needs this equipment for their employees, that there is a reliable source for that. And so the answer is, we don't have all the answers yet, but we are very much aware of the problems that have been in the supply chain, and we are working on creating a solution to ensure that all businesses will at least have access to a place where they can purchase these materials.
Great. Thank you very much. Question from Daniel Beekman at the Seattle Times. I believe this is directed either at the county executive or Dr. Duchin. Is this directive a requirement or mandate or not?
I think Dr. Duchin can best answer that, since he is the author of the directive. But I can tell you that it is a directive. It is not a requirement in the sense that it is a violation of the law if you fail to comply. That would not be the same as for employer-employee situations where employees are going to be required in many situations by their employers to wear a mask as a condition of their employment of being on the job. Dr. Duchin, did you want to talk about the directive?
Thank you. I just add that the directive is strongly encouraging, but not requiring in the sense of there will be no legal enforcement. So we are strongly encouraging King County residents to wear masks when they're in public and indoors as well as outdoor spaces where they'll have close contact and not be able to exercise physical distancing. This is an expectation based on, I think, what we all want, which is to do what we can to protect one another from developing this potentially serious illness, decrease the number of people who become ill, hospitalizations, and deaths. And wearing a mask is also a sign that we together care about one another and will try and do what we can to prevent ourselves from making others sick. So strongly encouraged at this point. I would also like to add that the Governor Inslee's proclamations that allow essential businesses to operate and other activities to happen are accompanied by requirements for the safety of the employees and, in certain cases, the public who come in contact with those businesses. And in some cases, those requirements include mask use. So I encourage people to review the safety requirements for workplaces and businesses that have accompanied Governor Inslee's proclamations.
Mayor Durkin?
Yeah, I would just also, one of the questions we have received on that in advance of this is if can a business exclude people for not wearing a mask or require a customer to have a mask to come on the premises? And the answer is yes, businesses are allowed to do that. We have a number of establishments who are requiring it now. Obviously, they cannot discriminate. All the laws against discrimination are in full place and effect, and I would encourage every business to understand the exceptions for masking children, people who may have hearing or other disabilities. But we know that a number of establishments have established those rules, and they are allowed to require people to wear masks to come into their facilities.
Great. Thank you. Dr. Duchin?
Thank you. I just wanted to add one more point, in that, like most of our other interventions, we need most people to comply with this, and the more the better. It would be really most effective if everyone followed this directive to wear face covering when they're in public and cannot physically distance. However, it's not essential that every one of us comply for this to work. And so if there are a few who can't or don't, this will still be an effective intervention if most of us do.
Thank you. Doctor, a few more questions for you here. What is considered an acceptable face covering? Do we need cloth masks, or can we use bandanas, shirts, etc.? This is from Nick Popham from Como TV.
Thanks, Nick. We do have guidance on our website where people can look at the options, but clearly the way your face covering is made and the way it fits will determine how effective it is. So in a nutshell, I'll just say that multiple layers are useful. Finely knit fabrics are most useful, and snug fit is most useful. A thin, loose face covering is better than nothing, but it's not as effective as one that is snug and has more layers. And of course, you still need to be able to breathe through it, because the whole idea is you filter your breath through your mask. You don't just push it around the sides, in which case it would be less effective. But we do understand that not everyone will have the same ability to acquire masks, make masks, and we may see a variety of different types of masks out there. Anything that covers the face will be helpful, but more snugly fitting, more layers will be more effective.
Great. And from David Croman at Crosscut, among others, Dr. Duchin, will you speak more to the COVID-19 trends you're seeing in county generally?
Sure. Well, over the past 2 weeks, we've kind of stabilized a number of cases. We're seeing, ballpark of about 80 a day. We're currently at 7,046 cases with 498 deaths. So this is not where we want to be as we move forward and have increasing levels of activity in the community. We would like to see fewer cases being reported, because we're concerned that as we start to go back to business, despite our best efforts, transmission will happen. And again, that's primarily because this disease can be transmitted before people know they're sick. And so this is why it should be obvious that we need to keep our distance from one another, because none of us know when we may develop this disease, and we don't want to be spreading it to others before we know that we're ill and can isolate ourselves. So we are continuing to see too many cases. Our last modeling estimate from the Institute for Disease Modeling suggested that transmission certainly has leveled off and may be increasing. We'll know more this week. But the bottom line is we haven't suppressed transmission as much as we should. We have too many cases occurring, and we don't want to risk going back to a situation where our healthcare system is going to be threatened by an overload of patients that will force us to put the brakes on again and put in measures that will force us not to come together, that will decrease our ability to get back to work and delay getting where we want to be as quickly as possible. So everything we can do to prevent transmission, staying 6 feet away through physical distancing, avoiding non-essential activities, continuing to have excellent hand hygiene, creating safe workplaces, and using cloth face coverings whenever in public, all of these things will help us move forward to the greatest extent possible as quickly as possible.
Thank you, Dr. Duchin. And one last question about the COVID-19 trends from Chris Daniels, King 5. How many ICU beds are in use for COVID patients and how many are open?
I don't have the exact numbers in front of me, but I can tell you that the healthcare system now has adequate capacity in both the ICU and the floor to treat patients who come in not only with COVID-19, but with any other medical condition. And I encourage people not to be hesitant to seek medical care if they've got symptoms for which they would normally seek medical care. We think that it's very important for people to go to their physician and particularly go to their emergency room if they're experiencing severe illnesses, not be afraid because of COVID. The hospitals are able to take care of patients at this point, and we don't want folks to have adverse health outcomes from other diseases because they're worried about overloading the hospitals with COVID right now.
Great, thank you very much. And with that, we will hand it back over to King County Executive Dow Constantine.
Well, thank you, and thanks for everyone. Thanks to everyone for being here today. I want to thank Matias Valenzuela, Jeff Duchin. I particularly want to thank Jenny Durkin, the mayor of Seattle, with whom I've been working on a daily basis as we struggle with this unprecedented situation. The success that we've had in this region is owing to the people who responded immediately, the people who've been willing to make sacrifices, the people who understood that even if they themselves weren't particularly vulnerable, that their actions could severely and tragically impact their neighbors. And we have to keep that spirit going as we look to restart our economies. We look to create opportunities for people to get back to work, to provide for their families. The way to do it is by being careful. I predict that you will see other major cities, major economies in this country open up too quickly and too recklessly and end up right back in a shutdown because their medical system, their hospital system is overwhelmed with cases. We do not want that to be our story. We want our story to be one of moving forward in a smart, logical, public health centered way that allows our economy to recover and allows people to get back to work. And I think that we have what it takes to make that happen. This is one more step in that process, in demonstrating that we care for our community and in doing all the things we need to do to ultimately defeat this virus. I want to thank you all for being here today and appreciate once again those who participated in today's call. Thanks.